Hi, I'm Dr. Iresh Shetty. I am a consultant cardiothoracic and vascular surgeon at KMC Hospital, Mangalore. Heart valves in the heart. The valves are basically like doorways between the chambers of the heart, and there can be different diseases affecting these valves. So the valves can either be stenosed, which means they become smaller and the opening becomes smaller and difficult for blood to go through. The valve can have a regurgitation, which means the valves are leaking, so it does not close properly and you have blood coming back to the previous chamber. Or you can sometimes have a absentia of valve or a valve that is not present, that is mostly seen in a congenital age group. The different causes for this valve disease could be most commonly in India, infection, which is called rheumatic heart disease. Other causes could be old age, sometimes congenital causes, that is from birth itself causing leakage of these valves, and sometimes something we call as infective endocarditis, which is an infection landing on the valve that has arisen from elsewhere. So valve surgeries are of two types. One is called a repair, another is called a replacement. So there are certain valves that can be repaired without having to remove it completely, which is all, there are certain criteria for those, and certain valves that have to be removed completely and replaced with an artificial or a prosthetic valve. These artificial or prosthetic valves can be of two types. There can be mechanical or metallic valves, bioprosthetic or a tissue valve. So both these valves have their own pros and cons, which is a long list, but mainly we talk about the medications that we require or these patients require following the surgery. If a patient has undergone a valve replacement following a mechanical or metallic prosthesis, they would require an oral anticoagulation, which is basically a blood thinner, for the rest of their life to maintain the valve within the heart. But if in case a patient has undergone a surgery with a tissue valve, a prosthetic valve, they need not have these medications for the rest of their life, but they will require it for the initial 3 to 6 months post surgery to maintain the valve, following which they need not have a high dose and they can tolerate this without any further medications.